Disc bulges, herniations, degeneration, prolapse, extrusion, slip discs. These are all common terms to describe damage to a lumbar disc. In today's short slideshow, we'll explain what these words mean, how it all happens, and what you can do to prevent this occurring, and what you can do to treat it. So let's start with a short anatomy lesson. What does a disc do? It's the softer part that lies between the vertebrae. It acts as a shock absorber, it allows our body to twist, bend and move, and without it we'd be stiff as a board, or move a bit like a robot. It also separates our vertebrae and allows a space for the spinal nerves to exit the canal and travel to our limbs. So let's look at some boring statistics. As you can see in this diagram, lumbar disc problems occur in about 39 to 43% of back injuries. And this was based on a recent study. And they've also looked at studies done previously, and that's what they've estimated. You can also see that facet joint injuries and SI joint or sacroiliac joint injuries are also very common. So, but the lumbar disc injuries are the most common reason for back pain, according to these research studies. So let's look at why this happens. The disc has an outer layer called the annulus, and inside the disc is the nucleus. When the two meet, there is danger. So why is that important? Well, the outer part, which is the annulus fibrosus, is made of shock-absorbing rings of fibrocartilage and glycoprotein, and that can tear when there is excessive rotation or flexion on the discs. So when this happens, fissures will form in that outer part of the disc, and the person may actually feel pain. So you will feel some pain due to the inflammation caused by the damage to that area. And over time, these fissures may get larger, and eventually part of the nucleus, which is also a type of glycoprotein made up of glycoprotein in the nucleus, and it's a bit softer than the annulus, and that will bulge out and can cause nerve damage and pain, subsequent pain. So let's go through the basic types of disc damage. Now the first one we're looking at here is a bulging disc, and that is when the inner part of the disc bulges out, but it's actually still contained within the annulus, and you can see that in that picture. The disc herniation, which is the next one along, is where the disc bulges out further, but it's still contained within the disc. The disc protrusion, or also called extrusion, is when the disc bulges out and breaks through the tough fibrous outer layer and impinges on the spinal cord. So there's an impingement there on the spinal nerves and potentially the cord as well. And a sequestration is when a piece actually breaks off, and that can be quite uncomfortable, as you can imagine. But occasionally it won't be sitting on a nerve, and there will actually be minimal pain. But most of the time there is subsequent symptoms. So what sort of symptoms we're looking at are things like sharp shooting pain. It will be referred often down the legs, and you'll also potentially get pins and needles and numbness if there is pain or if there is a long-term pressure on a nerve. So what causes a disc bulge? There is a few things. Repeated trauma such as poor posture, bad lifting and bending techniques are very commonly causes of disc bulges or disc injury. Sudden trauma, so a car accident or a nasty fall or something like that can cause it. Poor core stability and strength, because when we lift and bend and move, if our core isn't switching on properly, it'll put a lot of stress on our discs. Smoking's another reason, and that's because it's believed that smoking can actually dry out the disc and cause damage in the long term. Obesity, so if you're overweight, especially around the abdominal region, that can also put stress on the discs. And there are some genetic factors, but they're probably not quite as common. So how can a disc injury be diagnosed? You need to see a healthcare professional, such as a chiropractor, physio, osteopath, or even a GP or a neurologist or an orthopaedic surgeon if the problem is serious. And they can do certain tests, muscle strength tests, reflexes, they'll palpate the spine, they'll do orthopaedic tests, neurological tests, they'll review your symptoms and your history. Now, they'll also usually do an MRI or a CT scan, which will be more of a definitive way of determining what sort of disc injury you have if you do have one. Now, how can it be treated? There are a number of ways that it can be treated, and some of them are conservative, which includes chiropractic, physiotherapy or massage therapy. And there are more invasive techniques such as cortisone, steroid injections, also surgery, discectomies, or fusion if the problem is very, very serious. Now, it's all advisable to start off with conservative management initially, and then if that doesn't work over a period of 3 to 6 months, or if there are any severe red flag type symptoms, such as bowel or bladder disturbances or severe numbness, tingling or weakness, then often they have to operate fairly quickly. So, or things like issues where you're finding you can't feel around your buttock region, particularly, that's also of serious concern. So, if that's happening, obviously you need to go and see a health professional immediately. But if it's mild to moderate symptoms, there has been some success with conservative management. So that's the basic outline of what a disc is and how it can be injured and what type of injuries occur. I hope you've enjoyed listening, and if you have any questions, please don't hesitate to contact me. The question is it possible to actually heal the disc once it's been injured? And the answer to that question is probably no. What I've seen occasionally in my clinic is a situation where someone has had a sequestration, so a little piece of the disc has come off, and a year or two later they've been rescanned and that piece of disc is no longer there on the scan. So it's possible that the body has somehow absorbed that in its immune response. And therefore the person does have less pain. But that, I think, is quite a rare situation. And when you have a disc bulge or a disc herniation or a protrusion, it's probably likely to stay there for good. But the question is obviously trying to prevent it from getting worse by getting treatment and management, as well as strengthening the core, etc., to prevent further disc bulges up or above or below that area. And sometimes with certain exercises, I believe that maybe that disc can come off the nerve, or even some light traction and that type of thing, some mobilisation, can at least prevent that disc from becoming more dehydrated, because the disc does rely on movement to stay hydrated. So you do want to promote in the long term some mobilisation through that area, even if it is very gentle and very light. So that is pretty much the situation as far as whether a disc does heal. So that's why some conservative treatment does work, probably not in actually preventing or reversing the damage, but maybe managing the body, managing it better, basically. I would recommend conservative treatment, which includes light treatment, not rigorous stretching or rigorous adjustments, just light mobilisation, stretching, minimal traction, but occasionally that can help some people. But I think very light massage, mobilisation and stretching of the area, and just generally some good core stability and strength work can help, but it should be very light and very gently done. The other interesting debate out there is the question of disc bulges, because when they've done scans on people without back pain, they've found that they can still have a disc bulge or a disc protrusion. So how is that possible? Well, it's probably for a few reasons. I think some people just have a a body that doesn't feel as much pain as other people, and maybe a higher pain tolerance. I think also it really depends on whether that bulge is sitting on a nerve and how severe that is. So, just because you have a moderate disc bulge and a lot of pain and someone else has a moderate disc bulge and no pain, doesn't mean that it's the same, because obviously, again, it could be at a different part of the disc, could be more closer to a nerve, which is why it's worse. So you can't really compare one disc bulge with another, because they can be quite different in many ways. So I think it is important to always get a correct diagnosis and not to guess what's going on, because that, at least you know where you stand and what type of treatment might make it worse, and also how careful you need to be down the track. So I think it's really important to get a good diagnosis, so you know what your body can cope with in the future. But most of all, don't ignore the back pain that you're getting, and try and do something about it. Get some conservative therapy so that it doesn't come back. Even if it is improving, often they can come back and get worse. So get some treatment and keep going with some sort of regular body management and maintenance. Thanks again, and I'll speak to you soon.